Hantavirus is a rare but very serious virus that can make people dangerously sick. It is found all around the world and can cause a disease called Hantavirus pulmonary syndrome, or HPS. The virus is carried by certain types of wild rodents, like mice and rats. Most people who get sick with hantavirus have had some kind of contact with these animals or their droppings. The reason hantavirus is so important to know about is that it can be deadly. The disease often starts with mild symptoms, but can quickly become much worse. Sometimes even healthy people can get very sick if they catch this virus. That is why it is so important to learn how to avoid it and what to do if you think you have been exposed. There is no vaccine or cure for hantavirus. The only way to stay safe is to avoid being exposed in the first place. Understanding how hantavirus spreads and what signs to watch for can help protect you and your family. In this essay, we will explain how hantavirus spreads, what symptoms to look for, and the best ways to keep yourself safe. We will also talk about what to do if you think you or someone you know might be sick with this virus. Hantavirus lives in the bodies of certain wild rodents. In North America, the main carrier is the deer mouse, but other mice and rats can also carry it. These rodents do not look sick themselves, but they can shed the virus in their urine, droppings, and saliva. The virus gets into the environment wherever these rodents live or move. People usually catch hantavirus when they breathe in dust that contains the virus. This can happen when rodent droppings or nests are disturbed, especially when cleaning sheds, garages, cabins, or other places where rodents might live. The virus can also get on hands and then into the mouth or eyes if you touch contaminated surfaces. It is very rare for people to catch hantavirus from another person. Almost all cases come from contact with infected rodents or their droppings. Pets like cats and dogs do not spread hantavirus to people, even if they catch or eat rodents. It is important to remember that you do not need to see rodents to be at risk. Even old droppings, nests, or urine can contain the virus for a long time. This is why safe cleaning practices are so important, especially in places that have not been used for a while. If someone catches hantavirus, the first symptoms usually appear 1 to 5 weeks after exposure. These early symptoms can feel a lot like the flu or a bad cold. The most common ones are fever, tiredness, and muscle aches. These aches are often felt in the back, hips, and shoulders. Other early signs include headaches, dizziness, chills, and feeling very weak. Some people may also feel sick to their stomach or vomit. Sometimes people can get a dry cough or start having trouble breathing, but this usually comes later. These early symptoms can last for a few days or up to a week. Because they are so general, it is easy to mistake them for other illnesses like the flu. This is why it is important to think about whether you have been around rodents or cleaned up areas where they live. If you know you have been in a place where rodents live and you start to feel very tired, achy, or feverish, it is important to take it seriously. Early treatment can make a big difference in how the illness progresses. After the first few days of flu-like symptoms, hantavirus can get much worse very quickly. This is when late symptoms appear, usually 4 to 10 days after the early signs begin. The most dangerous problem is severe difficulty with breathing. People may start to cough a lot and notice that it is hard to catch their breath. Their lungs can fill with fluid, making it even harder to breathe. This is called Hantavirus pulmonary syndrome, or HPS. It can lead to chest pain, a feeling of tightness, and a fast heartbeat. Some people feel like they are drowning. Other late symptoms can include low blood pressure, confusion, and feeling faint or dizzy. If not treated right away, this stage can be deadly. The illness can move very quickly, turning from trouble breathing to a life-threatening emergency in just a few hours. Because the late symptoms are so serious, it is very important to get help as soon as breathing problems start. This is a medical emergency and needs hospital care right away. The best way to avoid hantavirus is to keep rodents out of your home and work areas. Start by sealing up any holes or cracks in walls, doors, or windows where mice and rats could get in. It's important to use metal or other strong materials because rodents can chew through wood and plastic. Keep food in rodent-proof containers and, Clean up any crumbs or spills right away. Do not leave pet food or bird seed out overnight, as this can attract rodents. Store firewood, boxes, and other clutter away from your house, and keep grass and bushes trimmed. If you see signs of rodents, like droppings or gnawed food, act quickly to remove them and figure out where they are getting in. When camping or hiking, keep food away from sleeping areas and store it in sealed containers. Never sleep or eat directly on the ground. Watch for rodent nests in cabins or shelters before using them, and always clean carefully before settling in. Simple steps like these can greatly lower your risk of coming into contact with hantavirus. Staying alert and keeping your environment clean are your best defenses. If you need to clean up after rodents, it is important to do it safely. Never sweep or vacuum droppings, nests, or urine, because this can spread the virus into the air. Instead, open windows and doors for at least 30 minutes before you start to air out the space. Wear rubber or plastic gloves and a mask if you have one. Spray the droppings, nests, or urine with a disinfectant or a mix of bleach and water, using 1 part bleach to 10 parts water. Let it soak for at least 5 minutes. Then, use paper towels to pick up the mess and place it in a plastic bag. Seal the bag tightly and throw it away in a covered trash can. After you are done, wash your hands very well with soap and water. Clean all surfaces with disinfectant and wash your clothes right away. If you find a lot of droppings or a big nest, or if you are not sure how to clean safely, it is best to call a professional pest control service. Protecting your lungs and skin is the most important thing. There is no specific cure or medicine for hantavirus, but quick hospital care can save lives. If someone becomes sick, doctors will focus on supporting their breathing and helping their body fight the virus. This might mean giving oxygen or using a machine to help them breathe. Often, people with severe breathing problems need to be in an intensive care unit, or ICU. Doctors watch them closely and treat any other problems, like low blood pressure or dehydration. The earlier someone gets to the hospital, the better their chances of recovery. Doctors will also take blood tests and chest x-rays to check for hantavirus and see how badly the lungs are affected. Sometimes people may need fluids through an IV or medicine to help their heart and lungs work better. Because hantavirus can become life-threatening very quickly, waiting at home is never safe if you have symptoms after rodent exposure. The sooner you get help, the better your chances are. If you have been around rodents or cleaned up their droppings, and then start to feel sick, do not wait. Early symptoms like fever, tiredness, and muscle aches can get much worse in just a few days. If you notice any trouble with breathing, chest pain, or a cough, go to the hospital right away. Tell the doctor or nurse that you may have been exposed to rodents. This will help them check for hantavirus quickly and give you the right care. The faster you get help, the more likely you are to recover. Do not try to tough it out at home or wait to see if you feel better. Hantavirus can change very fast, even in young, healthy people. Always err on the side of caution. Let friends and family know about the signs and risks of hantavirus, especially if they live or work in rural or wooded areas. Acting fast can save your life or the life of someone you care about. Hantavirus is a rare but dangerous illness spread by wild rodents and their droppings. The best way to stay safe is to keep rodents out of your home and avoid touching or breathing in dust from places where they live. Always clean carefully and use gloves and a mask if you need to deal with droppings or nests. Watch for early symptoms like fever, aches, and tiredness if you have been exposed. If you notice any breathing problems or chest pain, get to a hospital right away. Remember, there is no cure for hantavirus, but quick medical care can save lives. Share this information with your family, friends, and neighbors. Knowing the risks and how to prevent infection is the best way to protect yourself and others. Stay alert, stay clean, and take action if you feel sick after being around rodents. By taking simple steps and acting quickly, you can keep yourself and your loved ones safe from hantavirus. Prevention and awareness are your best defenses.